Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bites, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk about the progesterone component in hormone therapy. Hormone therapy is made up of estrogen and progesterone, and it is estrogen that's the primary component treating symptoms like hot flashes and night sweats. However, if you have a uterus, we will add progesterone as well. The reason we need progesterone in hormone therapy is to protect the uterus from cancer, which can develop if estrogen is used alone. So, if you've had your uterus removed, you don't necessarily need the progesterone. However, there are times where progesterone might still be recommended, even if you don't have a uterus. For instance, if you have a history of endometriosis or you need additional help with sleep. Our first choice these days for progesterone in hormone therapy is bioidentical progesterone. As a reminder, bioidentical hormones are plant-sourced hormones that are similar to human hormones, but not identical. To learn more about this, please listen to my other episodes on bioidentical and compounded hormones. Bioidentical progesterone comes in a capsule form and is usually taken at night as it can cause drowsiness, so it can help you with your sleep. A standard nightly dose of 100 milligrams is usually prescribed. However, if your BMI is over 30, we may increase the dose to 200 milligrams nightly. That's because a higher BMI is associated with a higher risk of uterine cancer. If you have a BMI between 25 and 30, the 200 milligram dose could also be considered. Higher doses of progesterone can be used to treat hot flashes and night sweats. This is an option if you can't use estrogen, for instance, if you have a history of blood clots. We usually use a 300 milligram nightly dose in those cases. I do hear a lot of requests for progesterone cream instead of the capsule. However, there is no FDA-approved bioidentical progesterone cream product. And that's because the bioidentical progesterone molecule is too large to be well and reliably absorbed through the skin. If topical absorption were reliable, we would have a combined estrogen-progesterone bioidentical patch. But we don't have that because bioidentical progesterone doesn't work well enough through the skin. So progesterone cream does not provide the necessary protection from uterine cancer, making it more of an expensive moisturizer than a legitimate and safe option for hormone therapy. In some cases, we may need to explore alternatives to bioidentical progesterone. This could be due to sensitivities to the progesterone such as mood changes, bloating, or drowsiness, or in cases of a peanut allergy. Bioidentical progesterone is suspended in peanut oil, so obviously if you have a peanut allergy, you can't use it. If you are sensitive to the side effects of the bioidentical progesterone, you can try using it vaginally instead, literally putting the capsule into the vagina at night instead of swallowing it. This approach may help reduce or prevent some of those side effects. But if that doesn't work, there are non-bioidentical progesterones that we might consider, such as medroxyprogesterone, that are FDA approved for menopausal hormone therapy. However, these non-bioidentical options are no longer our first choice due to an increased risk of breast cancer with non-bioidentical progesterone. Although this risk is actually pretty small and typically doesn't show up until you've been using hormones for 3 to 5 years. We also sometimes use other forms of progesterone in an off-label manner, meaning that they are FDA approved for different uses, such as for birth control, but not specifically for menopausal treatment. A common example is the progesterone IUD Mirena. While it's approved for menopausal hormone therapy in countries like Australia, it is not currently approved in the US for this purpose. If a woman already has a Mirena IUD, we can continue to use it for the progesterone component of her menopausal hormone therapy. But it's important to understand that although the Mirena IUD is effective for birth control for up to 8 years, we only use it for 5 years to manage menopause. So that's it for another episode of Menopause Bites. Here are some take-home bites to remember. The primary purpose for progesterone in hormone therapy is to protect the uterus from uterine cancer. We prefer the FDA-approved bioidentical progesterone, but sometimes use other FDA-approved progesterone products if you are sensitive to the bioidentical option, including the Mirena IUD. And finally, bioidentical progesterone is not effectively absorbed through the skin, so we use a capsule taken at night, which can also be used vaginally if you are having bothersome side effects. Until next time, may your hot flashes be bearable, your nights restful, and may your cravings be satisfied with chocolate.